Today, I am talking to Michael Johnson. Hi, Michael. Good to see you.
Hello. Nice to see you too.
Michael is the CEO of PracticeMax, and I want you to tell us, because we talked a little bit before, but I want you to tell us about how you went from being in TV to now being the CEO of PracticeMax.
Sure. Yeah, I've got kind of a different route to get to where I am. I was the station manager of the television station for a couple of years. That's true, and did that pretty early in my career. I was the general manager of what's called Davis Cable Channel 17, a local community TV station. Ran that for a couple of years. From there, I ran a nonprofit lobbying group for hotels called the Utah Hotel Association for a few years, and then spent a couple of years running a hotel construction company called Satori out of Salt Lake City, Utah. So very different, going from television to lobbying to construction. And then from there, I actually joined PracticeMax and spent the first couple of years of my time at PracticeMax running what we had at the time was a research company called Service Track, which we've since divested, but ran Service Track as a research company for a few years, and then moved over to the traditional RCM side at PracticeMax, really with my first entry into that, setting up, building, operating our Philippines operation, which we built up to about 500 FTEs in the Philippines. And so got to know RCM over the course of several years running that operation. Later became the Senior Vice President of Operations for PracticeMax. And then last year was appointed as the CEO. So had a diverse background for sure. I'm kind of the outsider at PracticeMax and frankly in the industry, because I didn't come up through the ranks of medical billing. And I think from one perspective, that's meant I've had a lot of catching up to do. And there's a lot of people around me that know a lot more than I do. But also it's given some perspective that I've been able to bring from the outside, and how business operations can look outside of the billing industry and how we can translate some of that into the way that the billing industry can operate. So yeah, kind of a diverse background for sure.
So I first met you probably when you first started at PracticeMax. And for those of you who don't know, when I first started going to HBMA conferences, I'm going to say 15, 18 years ago, PracticeMax was the company. They had so many people at that conference. It's the Healthcare Billing and Management Association. So anyone in healthcare billing was at that conference. And PracticeMax had managed to purchase a bunch of different billing companies. Many of the owners stayed on, and many of the owners were heavily involved in the organization. So just to give context, when you started at PracticeMax, what was the size? Like, could you share how large? Because as an outsider, it seemed like it's a pretty large organization. How big was it when you started?
Yeah, so it's interesting because I came on right before a lot of those acquisitions took place, and was involved in and participated in a lot of acquisitions. Like you said, a lot of HBMA members were acquired, billing companies across the country. We bought about 6 billing companies over the stretch of just a few years. And so we grew to be pretty significant. We had offices, we had 2 offices in Illinois, one in New York, one in Texas, Louisiana, Nebraska, 2 in Arizona. So we were pretty substantial in our footprint in every way, right? A number of employees, number of offices, geographic spread of our clientele. Actually, at one point we had 3 offices in Arizona. So I think we gobbled up quite a few billing companies and became quite sizable. And so when I said I've been surrounded by people who know a lot more about billing than me, we're talking about founders, CEOs, owners of and operators of all these different billing companies that have been in the company and that I've been able to learn from and rub shoulders with. And, you know, it's certainly thinking about my path, the opportunity to lead that group, you know, has certainly been an honor to have their trust and to be able to continue on the path of PracticeMax that has quite a storied history as you described it. We've, you know, been around and done a lot of interesting things.
How long has PracticeMax been around? How many years would you say the company, when was the company founded?
Well, the company was actually built off of some acquisitions early on, even. And so if you look at like the oldest piece, we go back over 45 years and have been around for essentially forever. But really, in the form that it is now, we're really talking about 23 years or so that PracticeMax has been around under the leadership of Bill Carnes, who was the previous CEO that kind of put it all together. So really, we're talking about 23 years of history as PracticeMax. But if you consider some of the acquisitions, it goes back even much further.
That's cool. So, and how do you guys still meet? Are all the founders still involved, or is Bill involved? Like, what's happened today, you know, in this climate now?
Yeah, not everybody is still involved. I think many of the acquisitions were done with the target of the owners staying involved for a short time, right? They had a kind of an end of career plan, which was sell the PracticeMax, stay on for a few years, move along. Others, you know, at various stages, it just wasn't the right fit for them. And so some have moved on other ways. Others are still involved. We've had, however, changes in ownership, and so most of our ownership has turned over to the point where many of those participants who came in with equity, et cetera, have been since bought out, and so many of them are not as involved. They're retired or completely retired. Although we do have some that still work with us and names that, you know, some folks would still recognize from HBMA.
That's awesome. Okay, so you and your organization have seen tremendous change over these years. I'm curious from your perspective, how do you see the future of medical billing, and what are some of the challenges that you're seeing? Challenges and opportunities, both.
Yeah, absolutely. So the future's, of course, on everybody's mind as we plan for the future. What does it look like? The reality is, I think that the medical industry and the billing associated with it is getting more complicated. And NSA is another layer on top of that. The No Surprises Act creates a whole new type of complexity for certain practices. And those types of regulatory changes, and on top of that, insurance or carrier payer bureaucracy changes are going to continue. I think we're going to have more and more complexity. That complexity is pushing billing companies in kind of two different directions. On the one hand, practices are finding it more and more complex to have the expertise, the knowledge base they need to do billing internally. It's just getting harder and harder to have one or two people or even a handful of people that hold down your billing shop in an internal practice situation. And so more and more organizations are going to find it difficult to affordably do billing in-house. So that's a great thing for the industry. And I think it's going to create a lot of opportunities as more practices continue to push towards an outsourced solution. I think at the same time, billing companies are having to really adapt. It has created a whole layer of experience and knowledge that's needed, right? For a long time, we thought, okay, our biggest challenge is the process of medical billing is so manual that we have to have all these FTEs, we have to have all these people involved. If only we can automate some of these processes and use AI in some of these processes, we're going to be able to cut costs and we're going to be able to bring down the complexity. And that's true when it comes to data entry. That's true when it comes to some AR work. That's true when it comes to payment posting. That's a fact, and it's a direction that the medical billing industry has to go in. But what these bureaucratic changes and changes in laws and other things are creating is this need for a layer of experts on top of that system. So yes, you take that system that used to be lots of people sitting in chairs doing work, and you try and automate that and use AI to kind of intelligently manage the workflow. But on top of it, you're going to have a layer of experts, people who can read and interpret the law, who can understand changes, who can keep up with changes, and who can then interpret that towards that machine, right? That machine that's going to be cranking out the claims and that's going to be, posting payments, et cetera. So I think that level of expertise is something that's harder and harder to come by. Small billing companies are having a harder time keeping up with all of those changes. It's just to be in the hamster wheel, which revenue cycle management is like the epitome of a hamster wheel. To be in that hamster wheel all the time churning, and also maintain expertise on every payer change and every state change and every federal change is getting more and more complex. And so I think a lot of smaller medical billing companies are having to make important choices. Do I limit the states that I operate in? Do I limit the specialties that I operate in? Do I kind of get smaller in my focus so that I can keep up, which is, I think, a great plan for a lot of smaller billing companies? Or do I need to take steps to get bigger through partnership, through M&A, through other means to get bigger so that I can have the level of expertise that's needed? I think for a long time, we thought, okay, if we outsource certain work, that's going to make us affordable, that's going to make us competitive, and so we can operate as a small billing company. But as the complexity increases, if you don't have that strong layer of expertise, it's going to be very difficult to survive at any size of billing.
So how is PracticeMax navigating this? I know you have offshore relationships. What do you think is the best model to address this concern?
So, when I came on as CEO, and even before that, as the senior VP of operations, I really took a look at what our strengths were as an organization, what our weaknesses were. And it became clear to me that we had some work to do on that bottom layer of the machine that I talked about, automating things more efficiently, creating more efficient workflows. And that included outsourcing more things than we originally thought we should. It meant increasing our offshore reliance in some ways. And so that piece of the machine needed work, and we've spent a lot of time building that piece of the machine. But I also identified that middle layer that manages the client account, that keeps up with industry changes, that are the experts that can speak intelligently to the clients, but also can inform and train that operational machine on appropriate updates. That middle layer needed work. And so we've actually had very important hires in that middle layer. We've increased and strengthened our director level, our VP level at PracticeMax to try and again, engage a level of experts that can sit on top of the machine. And that's been pretty revolutionary for us, and it's been really helpful. I think our clients have benefited significantly from those changes over the last, I would say, 12 to 24 months. Adding that layer, adding strength to that layer, hiring people with extensive skill, or putting people in the right positions that we had internally. And so that's been a big part of our adaptation is really, again, we know we have to work on that bottom tier because that's where a lot of the expense exists, and that's where we have to be really efficient. But that middle tier, we have to have the best people there. And we've worked really hard to do that.
That's awesome. It seems that you are heavily leveraged offshore. You mentioned you have 500 in the Philippines. I know you have people in India as well. What would you say percentage-wise, when you look at your entire employee workforce, what percentage of your workforce would you say is offshore versus onshore?
I don't know exactly what it is today, but I'll tell you what our goal is. We'd like to have our onshore be between 15 and 20% at the most.
Yep.
And really, it's only up to 20% because of some specialized work that we do with specialized individuals that also brings in additional revenue. Really, for core RCM revenue, we really want to be at about 15% onshore. And we're pretty close to that. I think, we're very near that, somewhere in that ballpark. And it's interesting because not only are we offshore, we're offshore pretty heavily in the Philippines and India. And a lot of what we've been doing the last 12 months is evaluating what should be in India and what should be in the Philippines. And we kind of took for granted that the Philippines, when we opened there, was a different kind of India. And we could do the same types of things and enjoy similar, although not quite as good as savings. We could have similar savings. And so we looked at it as kind of our own version of India in the Philippines. And what we've really learned is there are clear differences in kind of best practice, skill set, available labor is probably the biggest factor, and available expertise. And so what we've done is actually moved a lot of things that we had put into the Philippines into India, and moved some things that we've historically had in India into the Philippines. And so I think balancing that has been an opportunity to really work on that bottom machine again. And it's worked really well for us. We've got a lot of voice work and medical coding coming out of the Philippines. And we've moved a lot of the data entry, payment posting, and traditional AR work into India. And balancing it that way is a different approach than we originally planned. 5 years ago, 6 years ago, when we started in the Philippines, but it has been really helpful to us to get the cost balance correct and the deployment and execution correct in terms of our workflow.
Okay, I'm always very curious about this. This is like one of my favorite topics to talk about is Philippines versus India. But I'm curious what you started in the Philippines and what did you start with? Did you have AR in the Philippines and moved it back to India?
Yeah, we had certain clients that we were still outsourcing to India, and other clients that we basically said, we're going to, either outsource you to India or we're going to outsource to the Philippines. And that approach, it really, the first 3 or 4 years we were operating there, we were trying to run a full service, kind of end-to-end offshore operation in the Philippines. And while we still have some of that, we manage some kind of AR and payment posting, data entry in the Philippines. We've really changed dramatically our thinking about that. We believe that we can be more efficient, particularly in off hours, back office work. And when I say off hours, I mean those things that are not happening during the US day. That kind of back end work, most of it is we're doing now in India, and we're finding a lot of success in moving that back to India or moving it to India from the Philippines. So yeah, we've changed our direction, changed our approach with that pretty dramatically. And every time you make a big dramatic change, it's difficult, it's challenging for everybody involved. And so this past 12 months, as we've been making that change, we've gone through some bumps along the way. But I think overall, we're happy with that direction and feel like long-term, that gives us a better fit and a better balance for where we'd like to be long-term.
Would you say that your biggest issue in the Philippines is finding the talent, the medical billing talent, or what are some of the big issues in the Philippines?
Yeah, it's a combination. It's talent and it's rising costs. I think payrolls in the Philippines were always a little bit higher than in India, but the costs are rising much faster. And so, I think that's a big factor. But talent, there are certain cities in India where there's an enormous talent pool of 10 to 20 years of AR experience, right? Or 10 to 20 years of billing experience. And in the Philippines, in Manila, there's some of that, but outside of Manila, and we operate outside of Manila in a city called Cebu, outside of Manila, there's just not 10 or 20 years of experience. You're training most of your staff from scratch, and they're very trainable. They're very well educated. We've got good, intelligent workforce, but they don't come with that experience. And so if you need to ramp quickly, it's very difficult. It's fine if you have plenty of time to train and work people through the process. But if you need to move quickly and you need management level, director level, team lead level folks that can come in and hit the ground running, who already know the way it works, that's very hard to come by in certain parts of the Philippines.
Yeah, I've had similar experience. So thanks for sharing. Well, I know you just went to India and you were in Chennai, and I know you met with some of our team. Tell us about your trip. I want to hear about how was your trip to India?
Yeah, I just got back from India a couple of days ago. Spent a week there. I was in the Philippines a couple of weeks before that. So it's interesting and frankly, a couple of weeks before that, I was in India again. So it's nice to actually be able to be there and compare and contrast. I did have the opportunity to meet with a couple of groups while I was in Chennai this last week. It was a good trip. It was good to see the direction that different organizations are going. The challenge in Chennai is there's now so much medical billing work being done there that you've got this enormous base of talent, right? There's so many people that have 10 years of experience, so many. And so you've got this great talent base, but it's like every company there is growing, right? Every offshore operation in Chennai is growing like crazy. And so there's still a lot of competition for that talent. But it was really great to see. One of the things that has been a big improvement, we saw this with your organization, we saw this with other organizations there, is that middle manager level has gotten so strong and so much stronger than they used to be. And that's something that for those who did offshore billing in the 2000s when it was really gearing up, or the early 2010s, many billing companies had a bad experience. They offshored, they got really negative feedback. The communication was so poor. Things were not understood. Workflows were not, protocols were not being followed. Looking at the management now that's in place, many of those challenges were because of that lack of middle management. You'd have one great leader on top, and as they scaled their organization, everything fell apart, right? Because they were bringing on all of these new people and they didn't have enough experience to follow through. And now you have, I saw this in several of the organizations I met with, that there is a strong director and manager level group that I would put in charge of a practice. If I would have them run an isolated billing department at a practice and feel very confident that they know the whole thing. They know every piece of it. They're not just a payment poster. They're not just an AR person. They're somebody who can holistically look at an account, focus on KPIs, focus on overall collections, days in AR, and say, here, I can find anywhere from data entry to denial management, AR follow-up, and payment posting. I can find the issues anywhere in the continuum because I now know it so well. And that's exciting for Chennai. That's exciting for India to have that level of talent, which, I think was a challenge 10 years ago.
That's really great. Okay, as we conclude, first of all, is there anything you'd like to share that we did not touch on? Any final thoughts here?
Well, I mean, there's obviously so much to talk about in medical billing and in the leadership of medical billing. Being at HVMA not long ago, had conversations and have since had conversations with many CEOs and owners of billing companies, and the central theme is what's the right size of billing company to be? Is there a size that's too small to be successful? Is there a size that's too big to be successful? We've seen just in the last 2 days, some of the very large billing companies reporting financials, and public companies, and I saw one yesterday, very large, growing very quickly, RCM company that reported their quarterly earnings and lost $26 million last quarter. This is a company that in the same quarter last year was profitable. And they've grown since then and are now unprofitable in a pretty substantial way. So, size is important, but getting the right size seems to be really important as well. I think there are factors in healthcare that are highly impacting profitability, right? That, practices are struggling to make revenue if they've been out of network in the past, and now they're in an NSA environment and their revenues are dropping dramatically. So there's going to be some shakeups there. I think you're going to see practices consolidating to try and save money. You're going to see practices being sold to hospital systems. You're going to see, some real challenges on the healthcare side that are going to impact our industry as well. And certainly our industry's got some of its own challenges. Like I said, we've got a lot of smaller billing companies having a hard time keeping up. Their US domestic staff has gotten far more expensive in the last 24 months, and having to keep up with wages. We're used as an industry to paying wages to staff with 3 or 4 years of experience that are now the starting wages of Taco Bell. And, when Taco Bell's coming in at $18, $19 an hour to start, that puts some real pressure on, medical billing companies to up their game and get a little bit more aggressive in how they're paying domestic staff. So, I think there are some challenges in the industry. I think everybody's got on their mind what's the right size. And because of that, I spoke with a lot of billing companies that were asking the question, as an owner of a small or mid-sized billing company, is it the right time for me to get out? Is it the right time for me to merge? Is it the right time for me to go buy another billing company? Is consolidation appropriate? So I think we're going to see some of those conversations carry forward in the next 12 to 24 months as people are really struggling with the direction of billing. I will note increased interest rates are having kind of a major impact on the valuation of billing companies. We've been talking with a lot of organizations that are saying, a billing company that might have a year ago gotten 4 or 5 times the multiple of their EBITDA in terms of valuation, because interest rates have gone up so significantly, that same group might get 3 to 3.5 times the multiple. So we are seeing, again, these external economic pressures touching our industry and impacting the way things are happening here. Again, we could probably talk another 2 hours on that subject alone, but there's definitely a lot happening and a lot to keep your pulse on at this time.
Okay. Well, it seems like your organization's moving in the right direction. And for those, I like what you said about, niching down and having an area of expertise. I think that's great advice. I will add here that what I saw interesting about PracticeMax, which I really haven't seen in any other billing company, and I don't know if you still have it, but I remember Tim on your team has this like contract negotiation department, which I think is phenomenal. I mean, you guys have teams of attorneys that negotiate contracts on behalf of your clients to get your clients more money. So is that something that you're offering to other billing companies as a service, or is that just for PracticeMax clients?
Yeah, so you're right. Tim Carhu, who's been with us forever, I think something like 94 years he's been with PracticeMax. No, it's not that long. But yeah, Tim runs our contracting department, and that department has done some phenomenal work in providing contracting assistance, negotiation, a lot of analysis for our clients. We've built some nice contracting software that allows us to evaluate contracts, and he's done some phenomenal things with his team. We historically only allowed or only offered those services to our clients. However, we have in the last 12 months opened up both our contracting and our credentialing departments to be of service to other organizations. So we've taken on contracting and credentialing for practices directly that are not billing clients, and have been partnering with billing companies to provide those services. So we have a couple of billing companies that, they have their own operations, both onshore and offshore, but they go out and they've been telling their clients they can now offer coding services, credentialing services, and contracting services, which they actually don't do in-house, but through an agreement with us, we've said, go out and offer those services. We'll do the fulfillment. We'll help with those services. So yes, contracting is one of those areas where we feel like we've got a nice product set that makes a massive difference for practices, and has certainly been helpful in getting us, I think, ahead of the game in how we deal with NSA and strategy around how NSA impacts your overall contracting approach. And so, yeah, we're really pleased with Tim and his team and the work that they do.
That's wonderful. Okay. Yes, you and I could just talk forever. I know we're going to get together soon, but tell us where people can find you.
Well, I'm on LinkedIn. I think that's the best place to find me. If you do send an invitation, please send a message and mention that you heard me on the podcast, because sometimes I don't always accept invitations. But yeah, send an invite on LinkedIn, and happy to connect. I think it's great to work with the industry. We've put a lot of effort into partnership, and we have relationships with a lot of organizations. I saw you had Emily on your podcast, Emily Osatek from Pettigrew on your podcast not very long ago. She's a close partner of ours. We do a lot of work with them. I think there are really good benefits in getting together in the industry, helping each other in the industry. So yeah, reach out on LinkedIn. Happy to connect.
Thank you so much, Michael. This is why we launched this podcast, because so many synergies have been happening just from people just listening. So thank you for being a leader in this industry and for joining us today. It was a pleasure chatting with you.
Thank you, Channy. Really appreciate it. You have a great day.
Thanks.